My name is Alexandra Hess, and I am a health communications specialist at Weber Shandwick, supporting the Division of Viral Diseases at the CDC. I will tell you about our work to educate clinicians about acute flaccid myelitis in 2020. Acute flaccid myelitis, or AFM, first came to CDC's attention in August of 2014, when 9 patients with acute onset of limb weakness presented to urgent care clinics and emergency rooms in Colorado. All had abnormalities in the gray matter of their spinal cord. If this happened 50 years ago, we would assume they had polio, but flaccid weakness caused by wild poliovirus has been eliminated in the US since 1979. AFM is an uncommon but serious neurologic condition characterized by acute flaccid limb weakness and paralysis. Most cases have been in young children, and more than 90% of patients had mild respiratory symptoms or fever before they developed AFM. We have seen increases in AFM every 2 years since 2014, with most cases occurring in the late summer through early fall. Another AFM outbreak was anticipated in 2020. To better prepare for the potential increase in cases, we designed a national awareness campaign that had 3 target audiences: families, the media, and clinicians. We developed detailed communication plans for each audience to complement each other to maximize outreach. This poster showcases highlights from our formative research and activities to educate clinicians. Our formative research included in-depth phone interviews with 20 AFM experts to understand current practices and information gaps. We then conducted national surveys with practice-based, hospital-based, and urgent care-based clinicians to assess levels of AFM awareness and identified preferred communication channels. We found gaps in AFM awareness and lack of confidence in AFM knowledge among clinicians, lack of clinicians' understanding of their roles in addressing AFM, and gaps in knowing next steps. This confirmed that recognition by frontline clinicians remained a challenge, and more outreach and education was needed. Based on information from this research, we developed new education products and content, including multiple speaking engagements and several webinars in the summer of 2020. On August 4th, we released an AFM vital signs report with an in-depth analysis of patient characteristics from the 2018 outbreak. CDC Vital Signs is a monthly publication that includes a scientific report and a fact sheet and is accompanied by a social media campaign and partner and news media outreach. The Vital Signs effort led to many high-profile medical news posts and excellent national news coverage that generated over 1,600 articles. The estimated publicity value was $3.6 million, and our report performed in the top 5 of all vital signs since CDC began the program in 2010. We furthered our clinician outreach through partnerships with more than 25 professional medical organizations, which resulted in several AFM webinars and sharing of AFM information with their members. We designed a paid media ad campaign, and our AFM ads appeared in clinician-targeted Google searches, various medical e-newsletters, and on LinkedIn between June and December of 2020. This graph illustrates the effect of these efforts on the AFM website traffic in 2020, shown in blue, compared to the outbreak year of 2018, shown in green. Despite the pandemic, we had considerable success with this multi-pronged strategic campaign, providing a model and framework for successful programmatic public health communication work. I would like to acknowledge the team members who contributed to this work, and for questions, you can reach me at ahess@cdc.gov.